So let's get into the meat of it, the heart of it. This is the everything stages of labor. This is what gets you to have your baby in your arms. And for me, I love smelling my newborn baby's breath. I know that's weird, but you can't knock it until you have your baby, and you will have your weird thing for you and your baby, all right? So let's dive right into it. So stages of labor. There are actually 4 stages of labor. And the first stage has 3 phases. And the phases are early labor, active labor, and transition. Okay? And we will talk more about this later on. And the second stage is pushing, right? And after you push, you get to hold your baby. Stage 3 is delivery or birth of the placenta. And number 4, and this is a new stage that they added. So we are going to talk about this. Stage 4 is recovery and breastfeeding. And if you are not breastfeeding, bonding with your child, feeding with your child still is a part of stage 4. All right, so we are going to focus on stage 1, the very beginning, the one that people fear most, contractions and everything else, right? So let's talk about it. So early labor is really the time to actually rest, to just enjoy the space that you're in. Enjoy that you are getting ready to go on this journey, and acknowledge that, hey, I'm going to be seeing my baby soon, right? With today, the next day, whatever, but my baby, we know for sure, is on its way. So early labor is a time to rest, to stay hydrated. When I say hydrated, coconut water, actual water, right? Nothing else. I don't want to say stay hydrated and I see you drinking soda, or pop, or whatever you say. That doesn't count. So early, you eat, you rest, you stay hydrated, you spend time with your family if you want. Okay. So early labor, your contractions are usually 15 to 20 minutes apart. Okay. Your contractions last between 30 to 45 seconds. Okay? So they're 15 to 20 minutes apart, 30 to 45 seconds. And your cervix opens up in early labor between 0 to 5. Okay? 0 to 5. And I am going to post a picture or have you see a video that will show what it looks like when a cervix opens up from 0 to 5. Okay? So this is early labor. During this time, this is the perfect time to have your partner or your doula, your support team, to also give you massages, have you relax. This is the time most mothers like to maybe have light conversations. They still enjoy someone's company. They're still at all in the fact that they are in labor and getting ready to have their baby. All right. So this is early. Also, in early labor, this is the perfect time to keep moving, to keep your body going. So light walking, if you're standing up to sway back and forth with your partner, right? This is the perfect time to do that because birth, labor all of that, it loves movement. It wants you to move. It wants you to be a part of it. It needs you to engage. And when you move, this also helps your baby to go down into your vaginal canal, because every time you move, it also opens up a spot for your baby to move farther down. And that's why your body wants you to move. When women decide to have a natural birth, it's really important for them to move and to keep moving throughout their birth. All right. When you do not move, it can make your contraction seem a little bit more painful. Sometimes a very painful contraction just means you may need to move in a different position, right? Isn't that amazing? Yes, our bodies are truly amazing. So stay moving. Enjoy this time. This is the longest part of labor, right? Early is the longest part. It can be 6 to 12 hours plus. It's the longest part, which is good. Thank goodness something or somebody was looking out for us to make sure that early labor was the longest part of actual labor, of the first stage of labor, right? So active labor is, let's say, usually it's 3 to 5 minutes apart. You can say 2 to 3 to 5 minutes apart. Your contractions will last around 45 to 60 seconds. And your cervix will open up to 6 to 8 centimeters. Now, and let me tell you how long this will last. This can last 6 hours, right? 6 hours plus. And I just want to tell you guys something. I really do not like putting how long it may last, because everybody's body is different. And I really do not like putting a time limit, because I don't want to discourage a mother thinking, oh my goodness, she said at this time it should be, I should be in active or in transition. No, this is from books. This is the average, but everybody's body is different. And every time you give birth is different as well. So every labor, I'm getting tongue-tied. Every labor is different. So do not put a number to how long this will last, okay? But here's the average. So 6 hour plus is for active. Now, in active, there will be a difference in a woman's behavior, her attitude, and what she needs, okay? So early, it was a little upbeat. She's moving. She probably still talking and enjoying herself and really excited and anxious about this happening, right? But in active labor, this is real work. At this point, if she hasn't had or received any medication, she is probably saying, okay, if I decided to have a medicated birth and I want epidural now. Okay, this is a time where mothers get epidural. If a mother decided, I do not want epidural and I want a unmedicated birth, this is a time where she wants to really just focus on everything she has learned about comfort techniques, birthing positions, and she will just become really serious. She may not want someone to talk to her during active labor. She really wants someone to be there. And if she needs to sway back and forth, because in active labor, you are still moving. And you're probably moving a little bit more than early, because your contractions are coming a lot closer. You still get to rest in between your contractions, but right when you feel it, you're like, okay, it's time to go. Let's move. Let's move. During this time, a mother in active labor is breathing, probably really focusing on her breathing technique. Now, when I was in labor, I just breathe in and breathe out, and I just used my mouth because it was better for me. So I would sway, and I'll ooh, ooh, and you keep your mouth loose, right? Because anything tense, you don't want your muscles to be tense. And I'm swaying because I'm remembering everything that I went through. But you don't want your muscles to be tense. You got to remember your uterus is also a muscle, and your uterus is pushing your baby out. It's not just you. Your uterus can do it all by itself, okay? So if you are tense, all your muscles in your body are tense as well. And you don't want that to happen because you want your uterus to not be tense. And you want your pelvic and everything below to be relaxed and open. So it'll just be an easier journey for you and your baby. So to make this happen, when you are breathing during active labor, you can sway your hips, get into different birthing positions. I will show you that as well. I'll show you a clip, but I actually have a class about that. But what you can do is have your jaw just loose. You see this? This is so loose. Loose. When you tense up, tense up. The first thing you notice is when you tense, your lower body actually tense as well. It gets tense as well. So do that and then notice. So keep your mouth loose, your shoulders down and loose, and then you breathe. Remember to keep your body relaxed, your face, your jaw, your shoulders. And if you can't remember, because it's hard to remember when you're doing some work like this, have your partner, your birth support person, your doula tell you, remind me when I am not relaxed or you see my body tensed up, okay? This is something I do with my clients. If I see them like this, I tell them, your shoulder, and they relax their shoulder. I do not give them a full sentence, you need to relax. I don't do that. I just say your shoulder, because it's harder at this time for a mother to, comprehend everything that's coming at her. She's more focused. She may even feel like she's somewhere else. She may not know exactly who's in the room, who's not in the room. This is a time that she's really doing the work, and people just need to respect the mother and her space. So the best advice I can give you is, when you are in active labor, do not be afraid. Just let it come. Do not try to stop labor. Do not try to anticipate it. Just let it happen to your body. The more we fear, the more we try to stop it, can actually create more problems. And we will talk about that a little bit more, okay? So, transition. During active labor, a mother may also feel uneasy. Her stomach may feel queasy, and she may actually even throw up. This is normal. Just let your birth partner or whoever is in your team, just let them know what's going on, and they will pull your hair back. They will give you a bag. They will wipe your mouth. Trust me, I have done it plenty of times for my clients, and I have thrown up even during my labor. So please do not feel embarrassed. Don't feel embarrassed for any of that, okay? It's just natural. It's a natural part of things when it comes to labor. Also, when you are inactive, this is the time that mothers will start noticing that they may feel some pressure in their bottom, that they had pressure more in their back and early in the beginning of active, and now when they get closer to transition, from active to transition, that the pressure is going from their lower back to their bottom. So we're just going to just dive right on into transition, all right? So transition, the contractions are 1.5 to 2 minutes apart. The contractions last from 60 to 90 seconds. Now, I know you're looking at that and you're thinking, wow, when am I going to breathe? So we'll talk more about that. So 60 to 90 seconds. Your body does all of this hard work during transition because it opens up your cervix from 8 to 10 centimeters. And the average hours for how long this happens, or how long you'll be in transition, is 2 hours plus. Okay, now remember, this is different for everybody. And I also want to talk about the cervix as well. So we say 10 centimeters is the dilation you need to be for a mother to actually have her baby. But for example, if you are having a smaller baby, or if you're having a preemie like me, I may not need to dilate all the way up to 10 centimeters. I may need it to just dilate to 8 or 9. And I can actually start feeling the urge to push. And it's the true urge where I actually start pushing my baby. And I don't need to be 10 centimeters because my baby is smaller. And vice versa, if your baby's actually a little bit bigger than 10 centimeters, your body would actually get a little bit bigger than 10 centimeters. So this is very interesting, and I just wanted to point that out. Another thing about transition, as you can see, it's like really hard. This right here seems like this is a little tough, and you're not getting a lot of rest. And that is true. During transition, it is the shortest time period during labor. It is considered the hardest. This is the time where mothers do not really get a lot of rest. This is when mothers get really delirious, frustrated, scared, tired, and they really need to rely on their team, their partner, and sometimes their partner may have some encouraging words from them for them if they're doing a natural birth. Like, you got this, you can do it. You know, this is the time that the person will not only give them words, but also may help them with their breathing, like, oh, breathe with me. Ooh, right? Make noise. This is a time when the mother may be more vocal and she's louder because she's feeling more pressure. Now, I said in active, she will start feeling her pressure move from her back to her bottom. In transition, you will definitely feel pressure in your bottom area. And when it's your first time experiencing it, it's very overwhelming. And you just feel all that pressure down there. And then it gets to the point where you just feel like you need to push. And when you feel like you need to push, you need to tell your provider, okay? So with transition, if you have an epidural, you will still feel your contractions, but the urge of all that pressure down in your bottom may not be as strong as it would have been if you decided to have a natural unmedicated birth. So if you received your epidural active, this will be an easier easier transition for you. If you are having your baby naturally, most likely you are wanting to get into that position you want to be in. In active labor, you are moving, constantly moving, and just opening up your pelvic and moving into different positions that are very helpful for you and the baby. In transition, you are moving, but not as constant as you were in active. And when you do move in transition, it's like you find a position that you really like, and mothers usually stick with that position in transition. I also notice mothers in transition, they really kind of shut everybody out. And if they are with people. So say they have the team there, and they're having a home birth, or they're at a birth center and the midwife is there, the assistant midwife, and the dad or whoever is there. The mother may remove herself from the crowd and go to the bathroom until she is ready to actually push her baby. If you're at the hospital, and you're having a natural birth, you may try to move somewhere else. Depending on who is on staff, they may allow you to do that. Some are very strict where they don't want you to get too far from the bed. But you just try to figure that out. Try to figure out the environment for that particular hospital. Find out their culture when it comes to a birth setting, especially a natural birth setting. If you have an epidural, you're most likely going to be laying down, going to or trying different positions in the bed. Okay, so that is transition, and this is the first stage of labor. So let's go to stage. Also, when it comes to transition, do not be alarmed if you notice that you are feeling hot one minute, then cold the next minute. And also, if your body starts to shake, this is normal. This is a part of hormones and labor, and you're getting closer to the second stage, which is pushing. So let's start talking about this. Is stage 2, pushing. Now, pushing can vary from mom to mom. Okay, the time can vary. I have seen mothers push their baby out within 30 minutes to a couple of hours. Now, it's not necessarily a race. Pushing out a baby in 30 minutes is not a goal, okay? It's actually better to take your time and push your baby out within an hour, or at the hour mark or so, or hour and a half, right? It's not a goal. It's really the time to take your time to push out your baby. So one thing about pushing, your contractions actually get longer, so you get a break. They become between 2 to 5 minutes. They come every 2 to 5 minutes. Your contractions can last anywhere from 45 to 90 seconds. Okay? And during this time, you will start feeling the urge to push. Okay? Where you will actually push with your body. And a lot of mothers say this actually helps them when they feel their body ready to actually push their baby out. And when they actually start working with their body to push their baby out, they actually feel relieved, because now they're working with their contraction instead of just going through the contraction. They're able to work with the contraction. And mothers really particularly enjoy the fact that they get more time to rest during pushing. So take advantage of stage 2. You went through, early, active, and transition. And transition is a little tough. So during stage 2, pushing, please take the time to rest in between, and do not push unless you actually feel the urge to push. When you push and you don't feel the urge to push, that actually allows you to become more tired. You don't get to rest. You're spending energy for no reason, and then you actually have a higher chance of ripping your perineum. But when you rest in between the contractions and you only push when your body tells you to push, then you have a better chance of having the energy you need to continue going. You also have a better chance in keeping your perineum intact, okay? So a lot of mothers are concerned about ripping during this time, and that's why I say take your time. That's why I also tell you, do not push unless you feel the urge to push. And when you start pushing, you may not even know, like, am I doing this right? It actually may take a couple of times to practice pushing to actually get the pushing down. So don't worry about that. But another thing you can do is when you start to push and you start feeling pressure, because this is a time where you feel pressure, you feel your baby's head coming down in your vaginal canal, but then you actually start feeling everything coming out. And some people said they have felt a stinging sensation. It's called the ring of fire. It's a stinging sensation or a little burn. That's your body telling you to slow down, to take your time to push the baby's head out. Okay, so during that time when you feel that sensation, just pant, right? Or to breathe slowly in. When you breathe out slower than you breathe in, and really take your time to push your baby out. So that's the perfect time to just breathe instead of actually push your baby's head out, and you can avoid ripping by breathing. So you know how I just advised you to take your time and breathe when you're pushing your baby's head out? If you have an epidural, it may be harder. One, because you may not feel exactly what's happening to you. Two, people are coaching you when to push, and they're looking at the monitor, and they're letting you know when you're having a contraction to push. Now, that's not necessarily helpful because during the pushing stage, your body will actually have contractions, but then your body will have contractions where it's time for you to push, or when it's time for you to push. And if you're pushing every single time, I mean, it's really just a waste of time and a waste of energy. And then you're just pushing and pushing and pushing when you should only push when you feel the urge to push. And then that could actually cause you to rip. So if you have the epidural and you can't feel everything, but you want to make sure that when you get closer to pushing out the head, ask someone or tell your partner or tell your doctor, I want to know when my baby's head is near because I don't want to push. I just want to breathe my baby's head out. They should respect your wishes and let you know. All right. So that is stage 2. And I am going to go over some pictures to show you what that looks like. And I'm also going to show you different birthing positions or pushing positions that you could be. Oh, the third stage is when your baby is born and it's he or she is in your arms, and then it ends when you actually birth the placenta. Now, the placenta can take up to let's say 5 minutes, max like an hour, to be delivered after you birth your baby. This is the time that when you do birth your baby, you actually forget about everything else. Your contractions kind of stop at the moment, and your body's a little shaky, and you probably feel a little sick. You probably feel overwhelmed. You probably feel excited or just really tired, and you just want warm blankets and hold your baby, right? So you're having all these different feelings. The last thing you're thinking about is having more contractions to birth your placenta. So when it actually happens, you're like, oh my gosh, what's going on? And you're like, oh yeah, I forgot. I have to actually push out my placenta. Now, what I will tell you is take your time to birth your placenta. It is a lot easier than birthing a baby, but still take your time. Do not feel pressure. If you are feeling pressure, please tell the team. Tell the provider, I feel like you're pressuring me, okay? That is not right. Please also do not allow anyone to pull your placenta or anything like that, okay? So that's not right either, because if they pull it when your body's not actually ready to push out the placenta, they can actually break the placenta in pieces, and then they will have to actually put their hand or an instrument inside of you to scrape or to get out the broken pieces of your placenta in your uterus, and that is not fun at all. Okay, so during this stage, it is so many different feelings. It's your body going through so many changes. You're shaking, you're cold, excited, um, probably scared. You're having a whole bunch of different feelings, but it's a lot easier now to just push out your placenta than it was pushing out your baby. Thank goodness. Remember, it's small. Another thing that happens during the third stage of labor is the umbilical cord getting cut. Now, just remember when it gets cut, there are no nerve endings, so it doesn't hurt. The umbilical cord is kind of thick. I think a lot of people think it's just going to be like, I cut it, snipped. No, actually, you have to work the scissors through. So whoever decides to cut it decides, and it's really exciting. It's something that you will never forget. You can also decide if you want to delay cutting the umbilical cord, because the cord, like I said, if you delay cutting the cord, the baby can get all of the rich iron that it needs for the first 4 to 6 months of its life. And if you just wait until 1 to 5 minutes, most likely 5 minutes, or just wait to see when the umbilical cord stops pulsating, which is sending the blood to the baby, that's when you can cut it. So mostly people wait between 1 to 5 minutes. Another thing that people really start thinking about, and you think about this before you actually go into labor, but it's about your placenta. What are you going to do with your placenta? If you are deciding that you're not going to do anything with it, and you don't want nothing, you don't even want to see it, then the hospital will take care of it. But if you want to take it home, then you need to sign a release form, and you need someone to come and pick it up as soon as possible to put it in a cooler, and put it in a bag, a cooler, and take it away and keep it cold, okay, until you figure out what you're going to do. You can encapsulate it into pills or whatever you decide, and it can actually help you in recovery. It can actually lower your chances of getting postpartum depression. It can help you get back vital nutrients, energy during recovery period during postpartum. All right, so it's very popular, and in other parts of the world, people are doing this, and it's actually becoming more popular in the United States as well. If you are at a birthing center or a home birth, it's a lot easier to keep your placenta. It's like, oh, you want to keep your placenta? Okay, here. You just, sign or notify. I believe you sign some papers, and then that's it. It's not really hard. And then you do whatever you want to do with your... Yay, the placenta. This is the awesome picture, and I wanted to show you guys. Most people do not ever see the placenta or even see their own placenta. So I just wanted to throw a placenta in your face because birth can get real like that. So let's talk about some fun facts. It's considered one of the most important organs. It connects mom to baby. Only a body that's able to have a baby can actually produce and deliver the placenta or birth the placenta. It secretes hormones, HCG, estrogen, progesterone. It acts as a multifunction organ. It also acts as the baby's lungs while the baby is in the uterus. You can dispose, throw away, or ingest, actually eat, or turn your placenta into a pill and take it daily during postpartum. Delayed umbilical cord clamping. I talked about this in the previous video, but here are some benefits. It increases hemoglobin levels and improves iron stores, which mean after your baby is born and the doctor delays cutting or clamping the cord, the baby will receive all of the blood from the umbilical cord, and with that will receive all the iron it will need for the first couple of months of its life. So that's a cool benefit. For preterm babies, they increase red blood cell volumes and improve circulation. And there's no reason why Any provider should deny you of delayed umbilical cord unless the baby or you are in distress. Even if the baby has meconium, if the baby is vibrant and doing well, you can delay umbilical cord clamping as well. Look at this awesome picture. I think this picture is very powerful. A mother catching her own baby. I think is absolutely beautiful and gorgeous. So let's go in stage 4. What is it? It's recovery. It's the time to hold your baby. It's the time to connect and bond. It lasts for a couple hours after birth. You get to have your golden hour. What is the golden hour? So after you have your baby, doctors, providers, nurses, whoever, midwife, doulas, anybody, everyone should leave you alone. It doesn't matter if you're in a hospital setting, home birth, or birth center. Be left alone. You need to tell them, leave me alone for my golden hour so I can have my baby skin to skin. Skin to skin is important. You get to regulate your baby's body temperature naturally, just having your baby skin to skin. And you see that vernix? You get to rub the vernix in if your baby has vernix, because vernix is very moisturizing for the baby. It moisturizes the baby's skin and protects the baby's skin when it was in the amniotic fluid, and protects the baby's skin after birth. But having that one-on-one time for a whole hour, skin to skin, is very important bonding time for your baby. Not only does it regulate the body's temperature, it also increases oxytocin levels for you and baby, which actually encourages your body to start producing milk. And that's when you and the baby can have that bonding time to actually breastfeed if that's something that you want to do. Your baby is tired after it's born. You're tired, the baby's tired, and you guys just want to relax. But within 30 minutes to 60 minutes, your baby would actually want to breastfeed. So the best thing you can do is, if you decide to breastfeed, do not wipe your baby's cute hands. Let that amniotic stay on your baby's hand, because the amniotic fluid on your baby's hand smells like your nipple and will help the baby guide itself to your breast and to latch properly onto your nipple to breastfeed. And there are some wonderful videos on YouTube as well to show you that. Look at this baby. Oh, I just want to pick this baby up and say it's okay. So after you have your time, after you had your time with your baby, no one should ever rush you. After you had your minimum hour, golden hour, breastfeeding time and everything, then they're able to take your baby, clean your baby if you want it, see how long your baby is, weigh your baby, do APGAR score testing, and just assess your baby's health. And after they're done, they will give your baby back to you. After you have your baby back with you, you get to really enjoy your time with your baby and just bond. If you are worried about COVID restrictions, please contact your local hospital to learn more.